and welcome to this screencast on the effects of the Easy Does It therapy program for apraxia and motor planning by Elizabeth Parker, speech-language pathologist, Rocky Mountain University for Healthcare Professionals. The student chosen for this case study is a child on my caseload. The student is a 6-year-old female. She was recently diagnosed as a child with apraxia of speech. She has been receiving traditional speech therapy for articulation for 1 month. Her intelligibility increased from 15% with the context known to 25% within that month. The therapy approach was traditional therapy as described by Van Riper's articulation therapy approach. World Health Organization International Classification of Functioning, Disability, and Health is as follows. Body structure. There's an impairment of structure. It's most likely a structural impairment in the premotor cortex of the brain. Personal and environmental factors do not influence structures as her parents are well educated and socially appropriate. The parents reported no prenatal, perinatal, or postnatal difficulties with birth, nor any ongoing medical issues. Developmental milestones are all within age-appropriate limits with the exception of speech. Body function. There's an impairment of function. Slow alternating motion rate, AMRs, are noted. Severe difficulty with motor planning with severe inconsistent speech sound errors are also noted. Developmental milestones are all within age-appropriate limits with the exception of speech. Activity. There's a limitation of activity. The student's severe difficulty with motor planning and severe inconsistent ability to produce speech sounds affects her ability to communicate effectively with peers and adults. Again, intelligibility is rated to be 25% to an untrained listener. Participation. There's a restriction of participation. The student's severe difficulty with motor planning and severe inconsistent ability to produce correct speech sounds affects her ability to communicate effectively with peers and adults. Her peers have difficulty understanding her on the playground and in the neighborhood. The case study took place at Zia Elementary in Clovis, New Mexico, the population being approximately 40,000. Zia Elementary has 21 teachers, 7 educational aides, 1 speech-language pathologist, 1 part-time occupational therapist, 1 part-time physical therapist, 1 part-time nurse, and 1 part-time diagnostician. Average class size at Zia Elementary is 22. There are 433 students in kindergarten through 5th grade, of which 42 of those students receive 10% or less of special education services within their week. 20 students receive between 10 and 40% of special education services, and 1 student receives between 40 and 80% of special education services. There are no students that receive 80% or more of special education services within their week. 39 of those students receive speech and language services, with only 19 of those students being articulation therapy only. That would be the students that receive no other therapy. The student chosen for the case study was seen in the speech-language therapy room at Zia Elementary, the school in which she attends. The therapy room is a large room with consistent temperature. Background noise is limited to the heater and air conditioner. 1 other child was involved in the therapy process. The student was able to communicate with the other student and the therapist. Spontaneous communication that was observed included situations where the student helped each other and corrected each other's speech. There was also some distinct and healthy competition between the 2 students. Both of the students were 6 years old. However, the one not participating in the case history was a male and he was from another class. Opportunities to communicate were offered and encouraged throughout the 30-minute therapy session. Many of the communication opportunities were targeted toward producing correct articulation. During the rating of the intelligibility, at the end of each session, the communication opportunities were elicited by having the story read to the student. The student was then asked to retell the story using pictures in the book. These interactions were only with the licensed speech-language pathologist. The other student involved in the therapy process was taken back to the classroom before the rating process began. The student often related this story to personal experiences and expanded the conversation. So what was my question? My question was, does the Easy Does It therapy program, in combination of regular articulation therapy, decrease sound production errors in a severely apraxic 6-year-old child compared to the traditional articulation therapy, so that speech-language pathologists can provide the most effective therapeutic techniques for acquiring targets in the pediatric apraxia population? So, what is the Easy Does It for Apraxia and Motor Planning Therapy Program? It is a program that was developed by Downing and Chamberlain to aid therapists with students who do not show or show very little progress using traditional articulation or traditional phonological approaches. It was developed in 1993. The Easy Does It for Apraxia and Motor Planning uses the Van Riper's approach, traditional phonological approach, and the multisensory approach in a combination to meet the goals of the student. But what does the research report? What does the research support? It's unfortunate, but there was not any evidence found that shows that the Easy Does It therapy program is an effective treatment approach. However, there is evidence that shows that Van Riper's approach, the phonological therapy approach, and the multisensory approach are all effective therapy programs. The evidence from Eisenberg and Hitchcock support traditional articulation therapy as well as the Van Riper's. Evidence from McNeil's supports that the phonological therapy approach is an appropriate approach. Evidence from Womberg supports that the multisensory approach is an effective approach. And in conclusion, a systematic review by Murray, McCabe, and Ballard also support all three of the different types of therapy approaches. The Easy Does It therapy program is based on a combination of the Van Riper's approach, the traditional phonological approach, and the multisensory approach. And these journals demonstrated that all three approaches are effective. The objective of the treatment is to correctly produce sounds in conversation and to be intelligible. But what about the class status of each journal review? The first journal, the level of quality was a level 3, meaning the opinions, the authorities, descriptive studies, case histories, reports of experts and committees. The level of effectiveness, it did not meet the designation criteria. But the strength of the source was good. The benefits of the clinical services substantially outweigh the potential risks. The second journal, by Murray, McCabe, and Ballard, the evidence level was a level 2. The evidence from one well-designed cohort study or a case control study. The level of effectiveness was demonstrate effectiveness. The strength of the source was an A, good. The benefits of the clinical service substantially outweigh the potential risks. Number 3, McNeil, Gillen, and Dobb. The level of quality based was a 2 again. Evidence from a well-designed cohort study. The effectiveness demonstrated effectiveness, and the strength of the source was good. However, number 4, Womberg, the level was a 2-3, evidence from a multi-time series single-subject investigation or dramatic results from non-controlled experiences. It did not meet criteria for the level of effectiveness, and the strength of the source was E. It was lacking or poor quality or conflicting. The risk versus the benefit balance cannot be assessed. Intervention plan. The Easy Does It therapy program was used to address the student's apraxia to increase intelligibility. The program was pre-made with activities, and goals must be met before moving to the next activity. There's a therapy manual, therapy material books with instructions for the therapist to follow. The student was presented with daily activities. These activities had many self-motivating factors built in to the data program. In addition, the therapist used verbal reinforcement as well as a treasure box at the end of each therapy session. I feel full-heartedly in bribing my students. If they work hard and their behavior is good, they get in the treasure box. Implementation. Data recording for the student was documented in 2 ways. Data was collected to determine if the student was able to move to the next activity by achieving 100% accuracy. At the end of each session, the student was read a short story and then asked to retell the story. This was the intelligibility rating. Her speech was recorded, audio only. The recorded speech sample was then presented to a non-trained listener. And I do this with all of my students when I'm doing an intelligibility rating scale. I record them and then I find someone that is not a speech language pathologist and someone that is not familiar with the child and unable to recognize the child's voice to determine how many of the words that they can understand. They tally the words and then I divide those words by how many words were in there. That gives us a percentage. The raters were all adults over the age of 18 up to 80 years old. This could have skewed the results based on the age, because my 80-year-old might have some hearing loss. Also, gender could have skewed results because they wouldn't be familiar with girl toys, those kinds of things. For future, researchers may use raters with a consistent age and gender. Okay, so what does that look like? My students' intelligibility increased from 25% to 75% was the goal. However, the last 3 sessions, she made it to 80%. The administration of the Easy Does It therapy program was done with 100% fidelity based on the therapy manual. The record keeping for the intelligibility was measured after each session. The participant reported many times that she liked the activity and it was very fun. Since the activities are child-based and age-appropriate, the participant was completely engaged. Due to the intelligibility percent being rated by another professional, it would have been difficult for my student to chart her own progress. I did let her get a toy in the treasure box if her behavior was good. So now what? The program would have worked better if it could have been implemented 5 days a week. I don't think that my results of an increase from 25% intelligibility to 80% intelligibility over 10 weeks was typical. This may have been due to her intellectual ability. A diagnostician had tested her approximately 1 month before when the traditional therapy had begun, and her IQ was 125 standard score. So she had a higher IQ, she was motivated to learn, and she had not been intelligible for 6 years. And so she was ready. She was ready to be understood and decrease that frustration. Next step should be researching the program to include a single subject design. The program would work better if, again, if it can be implemented 5 days a week, and there needs to be some research to prove that this is an evidence-based program. Here are my references. Please take a moment to review them. Thank you very much.